A very good evening to all our viewers and welcome to this edition of the Evening Review. My name is Nghipangelwa, your host for tonight. Let's have a look at today's front page of Namibian Sun. Tonight on the show, we are joined by Josua Nghipangelwa. He is the Regional Health Director of Oshikoto to really speak to us about how everything is going in Oshikoto in this very difficult moment for our country. We have been focusing on the likes of commerce and Oshana, and in the process, we seem to have forgotten about other regions in the country. Mr. Welcome to the show. Thank you for joining us.
Thank you very much, Mr. Njebela, for this opportunity.
Wonderful, wonderful. Give us an overview of your region so far as COVID is concerned. Just in terms of, everybody's going through so much at the moment as far as the virus is concerned. What can you tell us about Oshikoto?
Oh, yeah. Thank you very much, Mr. Firstly and foremost, thanks so much for this opportunity to give an overview of Oshikoto region when it comes to COVID-19 pandemic. I start with the figure. Firstly, let me start with the number of people tested for COVID-19. The number is standing at 18,749 people. And the confirmed cases to date is 3,314. And for now, active cases are standing at 145. Recovered, those people who recovered from COVID-19, out of 3,314, the recovered are standing at 3,114. In the region, to date, we have death of 55. 52 are related to COVID-19, whereas non-COVID death standing at 3. And let me for now focus on district by district. Onanjokwe is the one that tested most of patients. The test at Onanjokwe stand at 9,820. And out of those tested, 1,144 tested positive for COVID-19. Tumep district is the second under the line. They tested 4,607 people, whereas 1,013 people tested positive for COVID-19. Omuthia is the last one. They tested 4,322, of which 855 people tested positive for COVID-19. The regional positivity rate is standing at 18%. And as I mentioned earlier, Onanjokwe is number 1, followed by Tumeb, and the third one is Omuthia in terms of positivity. Let me also talk of something related to COVID-19 vaccination in Oshikoto region.
Yes, please.
We managed to vaccinate 3,698 people in Oshikoto region for the first dose of vaccine. And for the second dose, we only managed to vaccinate 591 people. That is the update when it comes overview when it comes to COVID-19 pandemic situation in Oshikoto region. Over to you, Mr.
Thank you very
Njebela.
much. Yes, thank you very much, Mr. Nghipangelwa, for that concise update. Now, one of the issues that the whole country is struggling about is, of course, the logistics of how to help those that are hospitalized and those that are sick. Particularly in the context of oxygen, the availability of oxygen. What can you tell us about the Oshikoto situation in that regard?
Yeah, at the moment, since our patients are at reasonable number, we do not have a crisis at the moment when it comes to the oxygen needs. But as the number of patients might continue, we might be at a point of time in future, we might be in a crisis as the number of patients continue. But currently, the number of patients admitted and the number of oxygen availability, it's a reasonable amount that for the next 3 weeks we can still cope with the current, available resources when it comes to oxygen cylinders and the oxygen concentrators.
Sure.
Good.
How many people might be? I don't know numbers, but if you don't have the numbers, it's okay. But what is the situation regarding hospitalized people, especially those that might need admission to the ICU? Because elsewhere in the country, people are struggling also with beds in the ICUs.
The issue is availability of ICU beds, right, in the region?
Yes.
Okay, thank you very much, Mr. Njebela. To this one, I will start with Onanjokwe.
Yeah.
On has 30 bed capacity, 30. Whereas 19 out of 30 are already occupied by patients. Beds available today are 11. When it comes to hospital, they have bed capacity of 16. And today in the morning, they only had 4 patients. But they reported that in this afternoon, 1 patient was discharged, and then only 3 patients are available. Meaning that for now, beds available in Tumeb hospitals is standing at 13 bed available. Omuthia has bed capacity of 11 beds. The bed occupancy is standing at 4. Beds available now for those patients who might be in need of admission is standing at 7. The total number of beds in the region today readily available if we are to admit any patient today is 31. I thank you.
Thank you, Mr. Nghipangelwa. And then,
Good.
so in terms of again, this is very good. It's very good news. Oshikoto seems to have everything unrolled. If I look at just the explanation that you gave, also in the context of both and the ICU beds. But in terms of other resources like financial resources, I know that it is not a very decentralized system where the money lies with the office specifically. But are you getting that support just for emergencies and everything? Just with money readily available to procure whatever you may need.
Yeah, most of the items are procured centrally, but the other one is to say when we raise our need to the higher level at the head office, we receive quite a positive response. We normally get our supply as requested. And for those items that we might need to procure with our own budget, we don't have at the moment a situation that is beyond our control. We are on the right track. Let me say something also on this one. For instance, in case of oxygen cylinders, we normally get our supplies from time to time from the supplier, making use of the available budget at the regional level. I thank you.
Indeed, indeed. Maybe just share Nghipangelwa your secret. I think, I mean, generally nobody wants to share their secrets, but this is a good secret to share with the nation. The fact that Oshikoto seems to have it under control, fairly speaking, what is it that the region has done successfully over the time to sort of be in a comfortable position that you are in at the moment?
Probably I cannot say we are doing the best, but one thing I can say is that we were lucky to be given opportunity or to be given support from stakeholders, especially Dandies in Tumeb, Dandies precious metal in Tumeb. They assist us a lot in terms of some logistics. Even recently, just of last week on last Wednesday, we received some PPEs from this as a token of sort of social responsibility towards the Tumeb hospital, because Dundee precious metal plant is in Tumeb. Then Dundee has not precious, but Dundee has social responsibility towards patient care. That's the reason why we are a bit relaxed when it comes to some of issues, because apart from getting support from our ministry, we also get support from local stakeholders, of which one is Dante.
Indeed. Mr. Nghipangelwa, one of the challenges that your region faced in recent months was there were pockets of infections targeting schools in your region. I remember there were a couple of schools where a lot of learners tested positive. What can you tell us about that situation now? Is it any better?
Yeah, the situation is better. We learned a good lesson because we were one of those regions that had higher number of infection in schools, especially at Nehale Senior Secondary School. We might start with that one. We had higher number or over 190 school learners in that school. But what I can say is that we were cooperating very well with the Ministry of Basic Education, Art and Culture, the Directorate in Oshikoto region, the Namibian police, and other stakeholders, so that we contain the COVID-19 pandemic in that school, and so that we also put some measures to make sure that we put measures in place to eliminate the further spreading from those one who were infected with COVID to those one who were still negative, still tested negative. We also paid attention to the ablution facilities and some other in the school that requires attention. I really am commenting on the Ministry of Education, Art and Culture, Directorate, Oshikoto region, for a job well done. They did everything we, as Ministry of Health, Directorate Oshikoto, recommended, so that things are in place on time. Then also managed to have several meetings weekly to discuss issues pertaining to the situation in that school. When we happened to have Ukule and Ekulo senior secondary schools, we learned a lesson already. It was not difficult any longer for us to control the COVID-19 pandemic in schools. I thank you.
Indeed. Mr. Nghipangelwa, my last question is, Oshikoto is a very vast region. When you talk about Tsumeb, for example, and then you talk about other areas in the northern part of your region, that is a huge area to manage for a person like yourself. How are you coping with managing that whole space, especially in a time where you need to focus really your attention on this virus?
Come again, sir.
Oh yeah. So I was asking about the challenge of managing a big region like Oshikoto. Whether, of course, when it's a vast region from a COVID point of view, it's a good thing because at least then you can guarantee some distancing. But geographically, it also means that you are managing a very huge place, and for you to really be successful, it may mean redoubling your efforts. Just share with us the challenge of managing a region as big as Oshikoto.
Oh yeah, thank you very much. The region is quite challenging because of vastness, and it's also contrast. Apart from Tsumeb area that is stony, we have a district which is having far remote area with sandy roads and the unfavorable road conditions. What we are doing actually is coordinating the efforts of controlling the pandemic. We make sure that there are transport available, so that the team can also reach the hard to reach. A constituency like in Nghipangelwa is a far remote, is situated in the far remote areas. Those are the sort of constituencies I'm talking of, among others. It's just a coordinated effort, and also the district team, they are also communicating their needs on time. Then myself as a regional director, regional team, we provide support based on critics, to be attended. With those challenges, we are just coping, because I actually have a dedicated team who are working day and night to reach, hard to reach, places, so that they are able to provide services there. And I also have one good example. For instance, a constituency like Nghipangelwa, it's where we got a high number of people vaccinated against COVID-19, because we organized, the efforts of fighting pandemic with all constituency councillors in the region, which is making it easier for us to reach community in the far remote areas. One can say that in Oshikoto region, we are working hand in hand with our honorable regional councillors in the region and also the village headmen, so that we are able to reach people who need to be reached. The other platform we have is communication platform. We have numbers available per district where the community can call. For example, if there is somebody in need of assistance and he is or she is in the far remote areas, we might be accessed through that line by calling the number given to the community per district. And in some cases, they might even call the director. I am able to dispatch a team to assist in any way. I thank you.
Okay, yeah, okay. So give us your last words, Mr. Nghipangelwa, on a word of encouragement on vaccination. I listened to your first introductory remarks there when you were giving your overview, and the numbers are not as encouraging of the people who have showed up for their first vaccination. And I mean, compared to the population of the region, maybe just finally give us some sort of advice on or to the advice to your residents as far as vaccination is concerned.
Thank you very much, Mr. Jebela. My last word, I just want to encourage the community members to show up in big numbers at all health facilities in Oshikoto region for them to be able to get vaccinated. Because if you are vaccinated, there is a higher opportunity for you not to get the infection. And also, in case if you get your case will not be a worst case scenario where you will need oxygen. Let us stand in big numbers to health facilities, and those who can also make it through regional councillors do so that we make arrangements and dispatch a team to come and provide the service to your nearest destination. To me, the 3,698 is not a promising figure, but during the previous 2 weeks, the figure was just standing at 1,600, meaning that when we designed the approach with involvement of our honorable councillors, it's when the figure started showing promising. That's why the community are sort of encouraged to show up in big numbers, so that they visit the health facilities and the points where we are going sort of to inform them about, to say on this date the outreach services for vaccination is at, for example, at Onime or wherever place, so that at the end of the day, especially by mid-July, we want at least to have 10,000 people immunized against COVID-19. By so doing, you are not only protecting yourself, but you are also protecting people surrounding you. Because in your case, you might get a sort of COVID-19, but it might be a mild. But if the infection from you goes to another, it might be that one that requires admission and a need of oxygen. I thank you.
Mr. Nghipangelwa, thank you very much for your time today, sir, and we wish you and your team, and of course the whole of Oshikoto region, the best of luck as they navigate their way out of this dreadful virus. So thank you very much for your time, sir.
Thanks so much, Mr. Jebela.